order. Please rise and join the flag for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The school board will convene to executive session tonight to consider the employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility under Wisconsin Statute 19.85 C for the middle school cross-country head coaching positions, middle school, high school secretary, middle school special education teaching position, full-time special education aide position, school psychologist contract, and exit interviews. We have guests here, the people that check to speak. We want to speak to an agenda item, so we'll wait to that. But I realize often we've got people sitting in the office and we really don't know who you are, so I'll just ask you to go through and introduce yourself.
I'm Katie Thomas.
Seth Thomas.
Jamie Haslund.
I'm Lisa Sanson.
Jeff Sanson. Calvin Peters.
Darlene Peters. Tracy Watman.
Okay, thank you. We have the consent agenda. Are there any items anyone wishes removed from the consent agenda? If not, the consent agenda is approved by consent with some generous donations. The Mighty Pioneers at Pioneer Booster Club each gave $1,500 for the Steve Jones speaker fees. That was at the fall athletic meeting. The Door County Triathlon gave $500 for Destination Imagination. Jim and Heather Smith gave an unrestricted donation of $5,000 to the building project. They're one of our donors. And there was an anonymous donation of $4,000 for the athletic department. So we'll move then to the reports and administrators. Mr. Hiltz.
Thank you. Just want to take a moment and mention that Rainey is doing an outstanding job putting the hours in. She's really getting up to speed. There's a lot to learn, but she's really doing a nice job with great demeanor about it. So just wanted to give her kudos here tonight. Also wanted to mention a couple of things listed under challenges. One is the administrative team went and reviewed the data that we could. We recognize that there's kind of a hole in the data, if you will, because we didn't test last spring. We don't have anything to compare that to previous years, so we have to wait until this fall to be able to do the testing, and then we can compare that to previous falls. That will give us a better indication of any gaps that exist.
Are you seeing anything in the literature?
I'm sorry?
Are you seeing anything in your literature in other states that have data out now that would?
No, partly because a lot of them have run into the same thing where they didn't have that testing that they can take a look at. But we'll continue to take a look. I'm sure there are some things that teachers, when they get together, will compare notes. These are some of the things that we weren't able to cover last year, so that the next grade level will be prepared for that. And then the other challenge that I had in my report was just the ongoing socioeconomic disadvantages that exist within the district, and being mindful of that as we prepare for the things that we're going to do this year, as we have in the past. But one thing that we're planning on looking at is universal design for learning, and I think that will help some with that particular issue.
I really appreciate that report. That was really good. I think in one of my earlier meetings, I think I said how if we can get all kids to read to the 5th grade level, then they're going to be successful in the rest of their life. That's the key.
Not to pick on you, Mr. Work, but if you will speak louder so everyone can hear,
I'm
that would
sorry.
be great.
I said to him, as I said,
No, you don't have to repeat, but just so that people know that you're not having a private conversation on camera. They know that you're speaking to everyone, or directing to Mr. Hills.
the mouth's going, but
it's
nothing's
for
coming.
everyone to hear.
The mouth's going and nothing's coming out, right?
Yeah, diaphragm. Okay, thank you. Any other questions for Mr. Hills? We'll move to Ms. Margraf.
Two additions from my report tonight. The first one is some good news, and thank you, Sue, for reminding me. But we did find out that we did receive the mental health grant, and that's a 3-year grant, as you remember, that supports the STRIDE program through all Door County schools. So that's really exciting. So what that means is that United Way will now undergo looking for a new mental health navigator to fill that position. Want the board to know and the community to know that on September 10th, I'm also meeting with United Way to come up with some new ideas on how that mental health navigator can really support not just Sevastopol, but ideas for all the county schools. So I'm excited to meet with her. We've just had, a couple of years of getting Stride off the ground. Now we have the opportunity to say, how can we go a little bit deeper? And the second addition that I wanted to add is that, this week was new teacher training. So it's been pretty wonderful to see the new staff that are coming into the building and meet them and get to know them, on a deeper, better level. So it's been really great to see everyone. I'm not sure if you'll mention that at all too, but it's been wonderful. There's a lot of folks coming on board, and it's exciting to see that. In regards to challenges that we're kind of seeing right now, I would say that a lot of our students are coming back, maybe that have that weren't with us, last year. So just really making sure that we're assuring them and their families that the education, especially if they're students with pupil services, that we're going to have those meetings, and we're going to make sure that the students have everything that they need before they come into the, as they come into the building for a successful school year. So really talking to a lot of parents and, just reassuring them that, we can't wait to have their kids back, and we can't wait to support them in a manner that they need to be supported to be successful. So it's been busy.
Questions for Mrs. Margrove? Mr. Mayor?
Thank you. Final preparations are definitely underway. This has been a wonderful week. Actually, last week it started with registration orientation. I have 26 new students that registered for the middle school and high school, so it's really a good sign to see those numbers jump. My projections that I did give you in my report are a little off based on that, because I made those projections before we got this big bump, so that's outstanding. We had new staff in service, which we mentioned, 6 new staff members, and really getting to know them and acclimated in our building, and they all come with experience, so we have some wonderful teachers starting in our building. Also want to talk today, we had a substitute teacher orientation. A few years ago, we decided that orientations and just the opportunity to thank them for being part of our school, make sure they're part of our community. These folks are essential to keeping our building operating, and it's really important that we make them feel part of our building. We had 18 people attend today, 3 of them were new to our district, so there's a positive sign there as well. I also included in my report some more details on our weighted grade system. If you remember, the decision was made to go to weighted grades in 2019, and we had a gradual introduction of weighted grades starting with the first class of 2022. So this year's seniors will be the first class that had a chance to take advantage of weighted grades. So the first opportunity they had was in their junior year, because those classes are offered to juniors and seniors. In my report, I gave you a list of those classes that were identified by the teachers. I also showed you how that breaks down to a 5-point scale. Also made a comparison between the class of 2022 and the class of 2021. The class of 2021 did not have the opportunity to take those classes as weighted in their junior year. This class did in their junior year, and it ended up that we had 46 students in each class that took advantage of weighted grades. So there really isn't a difference there, but it's a small data set, but I just wanted to bring that to your attention. Another thing that came to our attention right at the end of the year, and this is my challenge for sure, Jerry, is that in implementing the weighted grades, we realized that there wasn't an equitable way to reward students for taking additional credits. I gave you the calculations and how that works, and actually the formula as it was, if you take fewer classes and get straight A's, you have a better opportunity of being the valedictorian than if you take more classes, and that's just math. It's mathematical, and I think I gave you that calculation on there. So our students will continue to have weighted grade point averages. They'll be able to report that to college and scholarship opportunities, but for the purposes of determining class rank, we're going to unweight those classes, and that is a recommendation from our grade management system, our advisory committee within our school, our council. Mr. Lidke was part of many of those conversations. We're going to continue to meet on a regular basis and make this system better. The next direction we want to go is just to review the weighted classes and make sure that they are rigorous and engage as many students as possible. So that's the next direction we're hoping to go with it. Any questions on that? I know it's a lot of information quickly.
Those 26 new students, they've never been here before.
Some of them have, but probably I would say less than 10. So there's 15 students that I have never had.
Are they coming
at
from other
Sevastopol.
districts?
Yes.
Oh,
And that 46 students, is that juniors and seniors combined?
Nope, this is a snapshot of the class when they were juniors. So the class that graduated in 2021. It's a snapshot of what courses they took that would have been weighted in their junior year. And to compare it the same way, we use juniors in the class of 2022. Yep. So that does not include their senior year because the current senior class hasn't taken any classes yet. So I couldn't include that data yet.
So, I follow kind of, so what you're saying is you're going to unweight the classes for valedictorian evaluation?
No, the only reason, just for determining class rank, we have to have a system, because the example that I showed, the student that took 8 classes a day without a study hall has a lower GPA, and they're ranked 3rd in the class, compared to a student that has taken the same classes, the same weighted classes, earned A's in all the classes, but taken a study hall each year for 3 years. They're ranked number 1 in the class.
I think to keep an eye on that data because
Yeah.
to compare a couple senior years ago, we didn't have weighted grades.
Right.
Weighted grades will work out to be an incentive to people on their curriculums towards school and to evaluation. So I understand what you're saying right now, but I think, and you look at schools with weighted grades, there are people that have aspirations to go forth. They're going to take more weighted grades.
Yeah.
And I think that should factor in, but I see where you're at right now. We'll probably come back to it down the road.
Yeah, we're still waiting.
I think your data is, because before we didn't have that scenario, you know.
Yeah, they're still weighted though, Dave.
They're still weighted. We're
It's
still
just the
waiting.
class rank part, so it's okay.
Well, what class rank matters to some people. That's my point.
Yeah.
And the number 1 guy gets a scholarship, or gal, usually a gal actually, gets the scholarship to Madison. So it
Well,
does kind of matter.
it's somewhat in the UW system, right? You can go any place you want.
Well,
in UW. Yeah, but exactly, but,
I mean, so that's a big deal.
yeah,
You better
but
be very thorough.
you'd have to sit down with Adam and I and Mr. Slice and go over the math, and
Yeah.
it was it's okay.
But David,
I'll do that, you know, I love math.
Yeah.
On another day.
But David, if I heard it right,
that can be a
Like a
learning
game?
session for us sometime.
It
Maybe
was
we
for
all
you
wanna
and
know.
Mr. Slice sat
You
me
know,
down.
we maybe all want to know, so we'll,
Yeah, it's math.
you could game the system by doing less and getting that number 1.
Well, you can do that now. That's, I mean, as long as you meet your high school requirements, you know, you can do that.
we will ask, when after school gets started and Mr. Schleiss gets his feet on the ground and isn't on maternity leave anymore, we'll maybe ask him to
There you
come to
go.
a meeting and give us a math lesson on it.
Because it is really mathematical.
Okay. We'll move to the athletic director gift and talented report. Does anybody have questions they want to direct on that? No? Then we'll move to the superintendent.
I need
So I was going to
Oh.
say, I thought that leadership meeting or whatever was set up. I just think that to move whoever all, that was a good idea. Steve Jones.
Were you talking about the Steve Jones
Yeah, the
presentation?
Steve Jones presentation, and I think this is our first meeting since then. And I think the leadership council that they're setting up that she's talked about will be good for our community, our classes. I think it'll help in the classroom once it's rooted and working. I think it hopefully carries through as well.
Good.
Well, to follow up on that, Dave, the coaches all met last night. And, well, after the parents and students left with Steve Jones on that night, the coaches all stayed with Steve Jones for like another hour and a half. And that was good. Then we had a follow-up meeting with coaches last night again. So it's progressing still. So,
Awesome.
you know, and we're meeting in October again. So we're trying to meet a little bit between the seasons, to give the coaches that are active in their season a little bit of a,
Superintendent.
Oh, okay. On your table, you have technical changes done for the policies. We had our policy committee meeting with Neola. So those are what I have. The rest of my items are within the agenda.
Okay. I don't have anything special to report. Committee reports. Policy committee, are we going to talk about that?
Yes.
Do the policies or right now?
We can talk about it a little bit later when we get to the policy.
Okay.
Okay.
Equity committee. Mr. Hiltz, Ms. Margraf, you want to kick that off?
Pardon me?
Equity committee?
Sure,
you
I'd
wanna
love to
kick
start
off?
that. met on August 2nd, 2021. And again, it was another honest, productive meeting where we really tried to focus on the long-term work of the Equity Committee. The biggest piece that came out of the committee was that we decided at this time that the Search Institute survey would be on hold. And for everyone to know, we're not financially obligated to Search Institute right now. We just felt like it's on hold right now. And then in addition to that is, if and when we decide to do a survey, the questions will definitely be available for people to look at. I made sure that I asked that question because I know that was a concern before, so there is full transparency in regards to that survey and being able to view it before students would be able to see that. I mean, to see the questions before we'd ever give that to a student, and that's parents and board members as well. So the other reason why, one of the reasons why we decided to not go forward with the survey right now is because Sevastopol has a lot to celebrate. There's a lot of really good things that are going on, not only just the new addition and the ribbon cutting, but then potentially the future of that universal design for learning. We have so many good things that are happening that we really want to focus on the positive as well. And committee members, we spent some time reflecting on the work that we've already put into the committee, and we feel more understanding of the committee's work and purpose is needed, and we need that universal buy-in from folks so we can create a positive and supportive environment for accomplishing the work that we hope to do. So we're just on hold, but the committee's work itself is going forward. Mr.
Yeah, and I think one of the things that came out of that discussion was that early on, sometimes you have things that you discuss in committee or in groups, and after a while, it becomes kind of commonplace that you've had those discussions. So when you talk out to a larger group, you forget that you've had those other conversations to get you to that final point. One of the things that we talked about early on was the term equity and kind of the charged nature of that word. So one of the things that we will talk a lot about going forward is culture and climate, because those are really some of the things that we want to try and get at to get a better understanding of, are there some things within our culture, within our climate, I think I've described before about that iceberg, if we can get down below the surface and see, are there some things in our climate and our culture that maybe we're not as aware of that need to be addressed. Pulling some of those things up, then maybe it does become an equity issue, and that equity term is more trying to address everybody and treat everybody in a similar fashion, as opposed to some of the charged nature of that word that exists out in the media. So that's something that was important that came out of our discussions. We're also going to take a look, as Melissa said, and see how some of the work that committee is doing ties back in with UDL and the strategic plans that we've already developed, and seeing how we can bring some of that forward so we're not duplicating work with some of that.
Another point that we did talk about as future goals for the committee is to include using that data that we talked about. We can, the new school report card and the district data, really being able to look at that to demonstrate, is there an equity issue? If we're looking at numbers and we're looking at academic data, that might be a great place to start, in the work that we want to do. It's the intention to bring, it's our intention to be able to bring that data to you in January. That's really what we really want to do. And the goal would be to highlight the areas where equity can be improved within the school.
And then studying equity and informing the board a little bit more about how equity works in other districts, some of the things that they're doing. Again, there's kind of that concept that exists within the field of education and work that's been done in prior years, not even in the last 18 months or the last 2 years, but things that have been done long term. And I think it's important for us to bring some of that forward.
Additionally, we're really interested in knowing what the county's equity committee, what they have to say as well. We want to make sure that we're following, not necessarily following along, but we understand what equity is for the Door County, and some of the conversations that they're having. So we really want to learn from that as well. So I know Mr. Lickey has been invited and will participate in that. So really working with him too to get some updates about what the county is, where their focus is on equity.
We've had one meeting, I had a different meeting on that day, and then a second meeting now, it got postponed, and now it's during our in-service days, so, yeah, I'll get there when I get a chance, yeah.
So, excuse me, and then lastly, one of the things that we're talking about doing is maybe expanding that committee a little bit, getting some additional perspectives, especially from community standpoint. I think as we've kind of gone through the process, bringing somebody in and getting them up to speed will help us understand what it is that we need to make sure that we convey so that we're clear in what we're presenting to everybody.
Any questions?
Well, I guess I'll just, I like that, I like what you had to say, and it's awesome. And I think digging back into what's going on is important, because, I just tie into other places and maybe things that we are doing that's good, because I'd like to remind everybody that there's a state law that we educate everyone fairly. So our schools have been attempting to do that. We talk about like bullying, we've continually been working on that. And bullying might be because of some of this. So I think what's important is, what I heard anyways, the way you're introducing it is weaving it into what we do already, but educating us a little bit more as we learn. So I think it's both sides, and I appreciate you bringing it that way. Instead of, hey, there's a brand new thing nobody does. No, there's some people and some staff members are doing things that tie into this already. So I think I just thought that was important.
I would go back to our strategic plan and utilize that as a part of this whole process, because in the plan we talked about pioneering the next generation to be inquisitive, solution-minded learners of integrity and resilience who embrace the power of differences through an inclusive, collaborative, and innovative learning environment. And then we talk about social responsibility. Each student will engage in opportunities respecting individual differences while cultivating civic and moral responsibility and the understanding that all people and actions in the global, social, and environmental community are interconnected. So I think there's a lot here that speaks to this whole topic.
Any other questions or comments on that topic? So that committee will meet again sometime and moving forward. Thank you very much. The budget.
For July, we transferred the $400,000 from Fund 10 to Fund 46. That'll reflect on the books for the 2021 school year. We can do it at retroactive. We also received cash revenue of $144,851. That was also credited the last school year, and $117,000 ESSER 2 funds. In August here, we'll receive the property taxes for the last school year, and those will go back to June 30th as well. And then Carl has the auditors coming on Monday, so that'll be all right.
And I gave you a report that shows the budgeted revenues and expenses. Those numbers will be what will be presented to the district at the annual meeting next Tuesday. Now, these are not final numbers because the budget does not go final until October. But we also found out that our valuation from last year is projected to be up about 12%. So that should do well with our mill rate.
That'll help the mill rate. The taxes the folks pay will be about the same if their property is increased by 12%. That number becomes final on October 15th.
Where are we holding the annual meeting?
As far as I know, it's in here.
In here?
Mm-hmm.
Okay.
Yes, it is, because that's where we, that's what we,
It's the end of, yeah.
when
That's
I put out the agenda in the paper 2 weeks ago, wasn't sure what was happening there, so we have it, it'll be in here. And that starts at 6:30. Now, we also put on there, because we always do tours. We're starting tours an hour or a half hour earlier, so we're starting tours at 5:30 instead of 6, in case people want to see the new building.
Not this one.
Not
this one.
Not-
The new school.
Well,
The folks are going to want to see what's going on over here too.
yeah.
We got, this end didn't get neglected.
And if you're looking for the district office, it is now moved. We're down in the old high school office now. We moved today.
Moved today.
Great.
We gotta put it together yet, but we moved.
Okay. The facilities, Mr. Lidkey.
There's a question, so we come to visit you, we go in from the old building?
Yeah, come in the old front door for what was door number 1. The doors will all be renumbered, but yeah, and you'll park in the front there.
To get to us now, you'll have to come in through the library, because you can't park out front.
Or you can come in the new front door.
Or you can come in the new front door and get lost.
It's the new front door's now open, we go up to one.
Yes. Yeah, the new front door is now open, so you can come in that way. So for the building, all the learning spaces will be ready by September 7th. The floor in the high school hallway was asbestos, so we had that removed with the abatement team. The flooring for there and the cafeteria and half of the face room are on back order. They say the ship date's September 12th. I don't believe any ship date, so it'll be cement, but it'll be clean and good. And then they'll come in, whenever they ship it, we will have to receive it. And that takes 3 days to put it down because they gotta let the glue dry. So we'll do that when like we have an in-service on a Friday or Thanksgiving break or Christmas break, we'll get those installed. But all the learning spaces are good to go. The north parking lot obviously won't be done, and that's because of the backup we had when they peeled off that cement foundation and they found all the field stone in there. I haven't received the bill on that yet. It's supposed to be between $80,000 and $100,000 still, but Ostringa hasn't finalized that bill. So that parking lot will get paved in September. The staff's going to park over at the church and shuttle over until it's done. The student parking lot we'll be able to park in tomorrow. They were painting the stripes today. So, and what else about the building project? There's a lot going on.
Are all the garage doors in the classrooms?
They're not all in. No, they're supposed to be here in
I heard
May.
they're putting up some.
They're going to put in temporary ones.
partitions.
There's some that are in. It depends where you're at. If you're in first grade, graphic arts to the Fab Lab, but 2 through 5 are not in.
So they're putting up something between the
It's
classrooms?
kind of like what they have a divider at a hospital, is what I've been explained to. Yes. They're going to wait till after open house to do that. And then we have open house on Sunday. The teachers were first allowed in the building on Monday to set up their rooms, and so they're in various stages of being ready for students. But by the open house in September 1, when the students come with their parents, all the rooms will be set for them for the opening of school. So I don't know. Every day there's something around here. You know.
So overall, though, you've done, considering how skeptical I was a year ago, you've done pretty well, right?
Yeah, we're all, I mean, you can't have a
always gonna
$200
be-
million project without some
yeah.
glitches, right? I mean,
Right, yeah.
Yeah.
I think you've done a great job.
Yeah, Mr. Retzloff and Mrs. Dantoin can't move into their rooms yet because of that. On the north end of the 1965 park, they're putting up a 2-story egress stairwell because you need a fire exit on that side of the building. And so Mr. Retzloff's wall has been being put up this last couple of days, so after that's finalized, they'll do the ceiling across with lighting, paint the walls, lay the carpeting, and then they'll get in, so hopefully they'll get in next week. The carpet guys like to come on Friday, Saturday, Sunday for some reason, and that's okay because that got us the 3 former science rooms this last weekend and Don Shire and Tim Newton's rooms up on the 2nd floor, so that was great. And Sarah Morosky's over here, so they came this weekend, did 6 rooms, that was really good. So there's a lot happening for the old grand opening. The fire doors to the 1965 part will be shut and they'll block off the door from the atrium to the cafeteria down by the Spanish room, just because they have their machinery and their tools and all that kind of stuff in the 65 part, so they don't want people walking on their stuff, basically. So yeah, so it's good. So yeah, it's clicking. Every day is something. So it's good. Yeah, it's been great to have the staff come back, and they got hundreds of boxes to get empty. So yeah, it's interesting. Field project. Asphalt for the track has been laid. It met the grade for Fisher track, which was laying the rubberized surface. The press box and bleachers, because the other ones were condemned, have been ordered or have a ship date. The irrigation system for the football field is going to be lower than the drainage system, which I thought was kind of odd. But that's, I don't know, 'cause the sprinkler heads pop up and go, so they're putting that in right now. And the fencing's going around that. Oh, also, the fencing's going up today around the propane tank and the retention pond, and the fence is already up around the 4K through first grade playground. So, yeah. So the field project is
Does the
moving along.
retention pond have a fence all the way around?
Has a fence all the way around it. It's, I'm gonna say 7 feet tall. It's tall, I think it's taller than me, so. What?
I think that's good, I didn't know that.
I think our insurance company,
Insurance company was.
That was a long time ago, that discussion, sorry.
Yeah, no, that was a 50-50 there. Sometimes they leave it open because they think if a kid goes over the top and falls in, then it takes longer to make the rescue. So we went with I think it's a 7 foot, but it's taller than I am, so it's got to be 7, maybe it's 8. I didn't measure it, I know it's taller.
Oh, good,
than I am.
someone asked and I was incorrect, I'll clarify the answer.
And it's attractive because it's got like turtles in it and stuff already. I mean, I can see
really?
Yeah, kids, when they walk around the school, they go to their band lesson, they come back and they report that, hey, I saw a turtle out there, and that's good to attract kids, so it's good to have a fence around it.
You can put a big tree, a dead tree in there, and they'll sit on it and sun themselves, and it'll be a science project.
All right, next summer we'll work on that.
Okay, so did you have something you wanted to report legislatively that was in your report?
Yes, just to add to the WASB components, the hotel block is now open for the January convention. I don't know if Jean has made reservations or not. It opened on the 18th, so those usually fill up very fast. I know Jean is usually on top of that, but I just thought I would mention it. And then on Monday of last week, I was invited as the state school board president to participate in the discussion with U.S. Secretary of Education Miguel Cardona. He talked a lot about the reopening of schools. He asked to ensure that we listen to the health experts. He recommended setting up vaccine clinics in the schools and using students to serve as advocates for the vaccine for those who are eligible. He recommended getting as many vaccinated as possible. He also talked about equity, and he said that the equity discussion will not be comfortable, but it is something that we need to have. He stressed that the next era in education will be better than ever. We need to take this opportunity to transform our education. And he indicated that he wants to be a strong partner with all of us in the schools. He's a very down-to-earth man, very dedicated to listening to school boards throughout the country. He recommended using the ESSER funds for staffing to help kids get up to speed in their learning. And he mentioned kids lose when adults are in turmoil. So it's important for us to have a measured, calm approach to all of this. He meets regularly with other U.S. government secretaries. In fact, he had to leave the conversation exactly at 12 o'clock because he had a meeting with the White House. He is focusing on areas such as career pathways, infrastructure, and climate. And he referred us to the U.S. Department of Education website, where there are 3 sections of resources, one on social emotional learning, one on academic recovery, and another on the reopening of schools. And he stressed that when we look at all of this, we make sure that the well-being of our students is foremost in our minds. And he talked about the unbelievable stress that our students have been through and using the American Rescue Plan dollars to address those concerns. Finally, he said, let health experts drive the decisions. And right at the end, he talked a little bit about the critical race theory, which is getting so much coverage in the media. And he talked about, let's not talk about that, but let's affirm the contributions of all groups. Let's keep this positive. Let's look at the beauty of diversity of our country. So I was impressed with the man. I felt like I was talking to a friend and having this conversation with him. So I think we have a good person in that position in Washington.
Okay, thank you. We'll move to old business, and Mr. Brenner and Ms. Margraf, if you want to give us any update on the dedication ribbon cutting.
Thank you. Absolutely. I'd like to invite the community to our ribbon cutting and school dedication this Sunday, August 22nd at 2 p.m. We will have an open house and tours of our facility from 2 to 4. And we're really excited about having the opportunity to dedicate this great building to our students. And we've met all of our deadlines. I think all the invitations are out. The cookies are baked. And it's just a celebration. It's the best way to end a committee. So it'll really be a great day.
Are you recommending board members wear our Sevastopol shirts?
I think everybody should wear what they're comfortable in. Wear what you're comfortable in. If you're comfortable with the Sevastopol shirt, wear it.
So I shouldn't wear my Chicago Bear shirt.
If you're comfortable.
It's tomato time of year. There might be some of those in the audience if you do that. Melissa, do you have
That's pushing it too far, right?
And the only thing that I would add is just to reiterate, it's been a really fun project to be on, a really fun committee, and I'm personally looking forward to seeing the parking lot filled with people. I hope it's a tremendous project and it's a tremendous opportunity for our community. So it's just excellent to be able to celebrate that. So I really hope that everybody can come.
Board members, there will be seats for you up in front here. Somewhere there'll be a tag with a name tag on your chair. I'll have name tags for you to wear. So, school board goals is back on here because I know we had this kind of two-pronged goal about gaps, and the administrative team is certainly working on that. The other part of that was a long and short range plan to maintain the physical plant, and I'm sure Mr. Lukey hasn't had time to look at that yet.
We're just getting this new building right now.
So, but sometime this fall, I would like us to have a goal-setting session and not rush it an hour before the meeting. Maybe it's a longer meeting, maybe it's a Saturday morning, just some time commitment, and maybe start looking, maybe not setting goals for this year, but start looking at goals. Maybe we begin by reviewing the strategic plan and encourage you to think about that, and maybe we'll talk about it in September when we can set a date for that.
Yeah, I agree. I think it should be a separate session.
Right. I don't like do a separate time, Saturday or another night.
I know it's like give up a Saturday morning, but if we can give up a couple hours on a Saturday morning, I think and focus on that, we can get a lot done. And it might not be a one-time shot. Maybe it's something we come back to 3 months later and refine, but we'll start there.
Maybe, maybe if you could find some articles for us to read about strategic plans, what strategic goals, because strategic goals are different than operational goals. And I think it's easy for boards to jump into operational goals because we understand them and control them and support them, as opposed to strategic goals, which are more at a 10,000-foot level and not at the 100-foot level. So from the strategic goals and the operational goals can flow.
I'll research some of that.
Okay,
Yeah, it'll be interesting because you've been through strategic plans quite a lot, I'm sure, so. Good.
And it's easy for us to fall into the trap of going into operational goals. And that's what you guys are supposed to do.
Next, we have on the agenda the 2021-2022 school operations and COVID, and we have three people checked off to speak on that. You have 3 minutes. Mr. Volkman will keep time. And we ask that if you're in a group that you speak for the group and everybody not repeat the same thing. So Seth and Katie Thomas, you were
We're separate. She doesn't want to associate with me. So my name is Seth Thomas. I have 3 kids here at Sevastopol. I am a clinical pharmacist at the hospital, and I'm the chair of the antimicrobial stewardship at the hospital. So I work with COVID treatment and data pretty much every day. Data like the false positive rate of our PCR COVID tests is less than 1%, and that we are still 1,000 more vaccinated or infected people in this school's community away from herd immunity, and we're not going to get to herd immunity. I'm not here on the hospital's behalf, but I am here for the community. Our kids need to be at school every day, so I'm here to urge you to make masking mandatory now for all at Sevastopol, to protect them and the community, especially those who aren't or can't be vaccinated. A lot has changed since your last meeting. I hope you are already listening to the experts from the CDC, the DHS, the DPI, our public health, and the American Academy of Pediatrics, who take into account child psychology, and that they all strongly recommend universal masking. With that said, I just wanted to clear up a possible misunderstanding with the interpretation of the data that Sue Powers brought to the meeting last time. The interpretation, after watching the video of the meeting, it seemed to be that since maybe less than 1% of our school kids contracted COVID, that COVID wasn't a public health emergency. That was very misleading, because in actuality, that statistic only speaks to the effectiveness of what interventions were put in place to prevent our children from contracting COVID. It had nothing to do with the virulence, the transmission, or the concern of COVID. Look to the south. Right now, schools are closing and hospitals are full. COVID is a public health emergency. That 1% statistic, though, however, shows Sevastopol did an excellent job preventing the students and staff from contracting COVID. 99% protected. Sevastopol deserves accolades for how it protected its students last year. Accolades. But that is why I'm kind of confused why we are considering removing the main intervention that protected our children. This Delta variant is much more transmissible than we saw last year. This is even better time for masking to be in place to protect our kids and keep them out of school, or keep them in school, at our school. Our kids can do it again. They have pioneer pride. That's all I have. Thank you very much.
Thank you, Seth. Katie?
All right, I'll keep it short. In a similar way, like I'm Katie, we have the same 3 children here at Sevastopol. I'm a nurse at the hospital too. I'll take this off so you can hear me better, sorry. And I'm also here to ask that we require masking in the school this year. Last school year was really difficult for everyone, between having the hybrid model for the majority of the year, and especially with having the school shut down for the 2 weeks before Christmas. Our children need to be in school. It's the best learning environment for them. And with all the changes in the past year and a half, having as normal a school year as possible is really important. I'm very concerned that if we don't do the universal masking as a requirement, that we're not going to be able to keep students and staff healthy. And if we can't keep our staff healthy, we're not going to be able to keep the school open. And we have to make keeping school in session the priority. Unfortunately, as Seth mentioned, we're not dealing with the same virus as last year. The Delta variant is being spread more quickly and more easily. And unfortunately, even if you're vaccinated, you can still contract and pass on COVID, and you'll need to quarantine if you are COVID positive. If the prevention measures we had in place last year worked, now isn't the time to remove them. I urge you to require masking not only for the elementary students who aren't eligible for vaccines, but also across the board for all students, staff, and visitors, regardless of their vaccination status, because it can still be spread even amongst vaccinated individuals. This way, there's not going to be a need to try to determine who's vaccinated and who isn't, and who should be wearing a mask and who isn't. And those who have chosen not to vaccinate won't feel that they're being discriminated against by having masking a requirement for them and maybe not someone who had been vaccinated. Please listen to the experts. They all recommend universal masking in school settings. Our children masked up last year and they can do it again. Let's keep sending them the message that we believe they can do hard things and that pioneers care for one another. Thank you.
Thank you, Katie. Jeff Swanson? Sweat. Maybe I got the wrong name up.
Pretty close.
Sansa.
Pretty
Okay,
close.
sorry.
Okay, so I really appreciate what you two guys shared. I am coming at it from a different perspective from you, but I do respect where you're coming from, and not trying to make this into an argument session in any way. We're saying that we're in a health crisis, but we're only at 0.23% disease case burden in Door County. So far there's been 0 deaths in Door County in August. Vaccination is now at 70% in Door County. Yesterday the Sturgeon Bay School Board voted 6-3 to keep masking optional in Sturgeon Bay. I hear that you're saying that all the experts are recommending masking, but there is some room for debate in the scientific community about how credible the recommendations of the CDC are. If you look at their studies recommending and putting forward why you should mask, most of them are very, very small, and they choose to reject the Danish study, which was far greater. The reason they give for rejecting that was because it was not statistically significant, yet their #1 case study is based on 2 hairdressers and their patients. I mean, so it's not clear cut. So I would like the school board to consider respecting individual liberty here in Door County and giving people the choice for their children. If you want to vaccinate and you want to mask, please go ahead and do it. But if the vaccination doesn't do anything, as we've just heard, why would masks do anything when it's proven that they're not, I mean, the disease is very transmissible, yeah, we get that, but wearing a cloth mask on your face, I don't really see how that's going to stop a disease spreading if it's really that transmissible. But again, I'm not wanting to be confrontational or argue about it. I respect the work you do in the hospital, and I appreciate that. And we just have a different perspective on it. And I would just ask that people be given the freedom of choice in this situation. So thank you for listening. Appreciate it.
You sir came in late and didn't have a chance to sign up if you wanted to speak. Did you want to speak on any items?
I'm covering for a newspaper.
Oh, okay. Thank you.
Couldn't get out of my job. Sorry about barging in. No.
All right, I guess we'll let Mr. Litkey.
On your table, you have a few sheets of paper. One is why we wear masks. This was provided to the superintendents by Dr. Fogarty this week. You can see that if you stay at home, you got nearly none transmission of the disease, all the way up to the very high up. Neither wears face coverings, and you stay less than 6 feet apart. We had a meeting with Door County Public Health. They did recommend that we wear masks. They have referred us to DHS and DPI for masking. All of them make recommendations, none make requirements. I did ask Door County Public Health. They said at one point if we didn't do masking that we were being reckless. I asked them if we went with no masking, would you then go from your recommendation to a requirement? And Door County Public Health said they would not go to a requiring masks. Another sheet you have is the CISA 7 schools and what their plans are. This is as up to date as I have. And then the third one is my write-up after listening to the meetings with the folks and what I think is best for the students here at Sevastopol. I think masking optional is best for our students. After witnessing our kids wear masks last year, they did a great job. But the CDC tells us that they have to have a 2-layer washable, breathable fabric. I don't know if all of our masks that kids come are like that or not. I can't guarantee that. And I can't guarantee our kids always wear them properly. They say they gotta be snug. Well, I don't know who's gonna measure the snugness all the day. We tell the kids keep them on, they do well. I think the best thing we did last year was hand washing. I thought that really improved a lot. We will work on our physical distancing. Staff will space desks and students as best possible to accommodate social distancing. And staff will keep seating charts for all the classes. And staff will try to limit the duration of group activities where individuals within 3 feet of one another. We will quarantine for 10 days is the recommendation. Any student or staff member test positive for COVID, plus any sibling or member of the household of a positive case. Student exhibiting either a cough, shortness of breath, difficult breathing, or new loss of smell or taste will exit school. And if they have 2 or more of the following symptoms of fever, headache, sore throat, fatigue, muscle or body aches, congestion or runny nose, nausea or vomiting, diarrhea, then they'll have to as well. They may return with a negative test or 10-day quarantine period if provide no symptoms or at the time of the return. Instruction during the quarantine period, staff will utilize the Google Classroom for the students. Staff and students will then communicate via electronically, and materials for the students will be prepared and able to pick up here at the school. Extracurricularly, the athletic teams will follow the WIA protocols. At away games, we will follow the protocols of the host school if they're more stringent than ours. And if we're playing at a different place, because like our football team doesn't have any home games this year, if we're using another team's facility, school's facility, and they have tighter guidelines, we will be a good guest and respect their attitude, their requirements. So that means like if we go someplace and the other school's masking, then our team will mask up to play them because that's being respectful of our neighbors. And our games and concerts and school events, I plan to have full audience attendance. If someone feels uncomfortable, then please ask them to stay home. And that's my recommendation at this point.
One thing on, excuse me, on that, all athletic teams, when they travel on a bus, will be required to wear a mask because public transportation, you have to wear a mask in public transportation, and a school bus is considered public
And
transportation.
that's to and from school, that's all times on school buses or in school vans.
Right.
Right. We will follow that because that's required. So that's my recommendation.
Kyle, I have a question.
Mhm.
Just a clarification. So Public Health said that they feel that if we do not go universal masking, we're being irresponsible,
Reckless.
reckless,
Mhm.
but they're not willing to take the position that we should all mask.
They won't make it a requirement, they said.
I'm confused about it.
And the other
Did
part
they
I
say
had,
they
the other
can't make it
difficulty
a-
I had
can't make it
was,
a requirement?
what?
They can't make it a requirement?
They said they wouldn't.
Right.
The other problem I had was, I don't know where the threshold would be that we would not, they always say it's too high, you have to wear masks. So I said, what's the threshold to get us to where we don't have to wear masks in your opinion? And they wouldn't give me an answer to what level we have to get to. How low does it have to get to it's safe we can go without masking? We take risks every day in life, you know, I mean, there's car accidents, there's other tragedies. This, I think, is the way the world's gonna be for a long time here. There's other variants out there rather than just the one that's active right now, the Delta. There's other ones out there, and it could do this multiple times, and each one could be more dangerous or less dangerous than what we have currently. So this is, to me, the new normal.
I would also add the statistic of 70% of vaccination in Door County, and I don't know what the number is or we're not at herd immunity is, but I think the opportunity for people, and I know people that are vaccinated are getting COVID, obviously much milder, but I would agree that this is probably going to be around for a long time, and you know, people have the option to wear a mask. I don't think, you know, both my kids have been vaccinated and they did it because that was their choice, and you know, I think a lot of other kids have done that too, and to make them mask, I think, and I think for now, I think we're good.
The other thing is, if you don't feel comfortable in this environment, you can do online schooling for the entire semester. You just have to meet with one of our principals and arrange that through a third party. So we do have that option. If the setting here is not to your safety level, we will still offer an education for those students.
I feel personally that masking really skirts the real issue, and that's mandatory vaccination. I think by October 1st, I think the landscape is going to be changing dramatically. And we're seeing not only businesses, but we're seeing healthcare providers beginning to mandate vaccinations. And I think until we have a serious discussion at this school regarding mandatory vaccinations, we will keep revisiting this situation over and over and over again. And that's really what it comes down to. I think in the next 2 months or so, we're going to see probably an FDA approval for ages 11 and down. We've already seen approval for booster vaccinations. The federal government is going to demand that nursing home employees are vaccinated. That's going to become mandatory.
That's already happened.
It's already happened. If they don't, they'll lose their Medicaid, Medicare funding. That to me is the real issue. And, you know, my opinion, a lot of people will say, you know, it's my personal freedom not to be vaccinated. And I say, well, is it your personal freedom to endanger the safety of people around you? And that's what it comes down to. You know, I took the effort to be vaccinated as soon as I could, and I did it because I wanted to somehow have the assurance that vaccination gives you, and I also wanted to have some type of return to some type of normality. And I think, you know, we can talk about masking. It certainly has become a political issue. Why? Well, who knows? But, you know, vaccination in this country has to become a mandatory issue, period. And the science is there for it. And otherwise, we're just going to keep grinding our wheels day in and day out.
I would agree 100% with everything you said. I think we need to follow the science. Secretary Cardona talked about the need to really emphasize the vaccine, to have clinics in the schools if we need to have them, wherever we need to have them. You know, I understand everybody's freedom. People have the freedom to drive down the road drunk too, but not if it's going to harm me or harm you. You know, I just think that we have to, for the good of everybody, we have to get beyond this barrier.
Right. And I mean, there's a reason why we don't have polio occurrence anymore.
Exactly, or smallpox.
Or smallpox, or even a measles occurrence. It's because we had mandatory vaccinations.
No, we did not. No, that's not correct. We never, with kids, but we never required mandatory polio vaccinations, measles vaccinations, or flu vaccinations with adults.
So
that's always been voluntary.
So our topic is masking. I understand what everybody's saying about the vaccination.
Okay.
Our policy is masking.
But it's related to masking.
It is, but we can't, so are we gonna put on the agenda the discussion next time of mandatory vaccination for staff and students?
Right. I think once the FDA gives approval for ages 11 and younger to be vaccinated, I really think we have to, you know, be progressive. And I'm not sure if, you know, our state legislature is going to challenge it. The University of Wisconsin system has already set in place their system for vaccination. If you're not mandatory, if you're not vaccinated, you're required to be tested every 5 days in UW's system. Now that goes directly against what the state legislature has been proposing. So I don't think it's going to become a challenge for this legislature. I think it's going to be district by district. And I'm sure DPI is going to come out within the next couple of months and start having a pro-vaccination discussion.
This is a question, because I'm certain I agree with that. I think the FDA is going to come down with. Well, of course, they have to get the adults ones, was still experimental.
Yeah.
They haven't. What's holding them up, I have no idea. But since after gazillion millions of us have the vaccinations, but they haven't lifted. It's an experimental, and I think children's going to come right behind it. As a point of information, what's the current rules with regards to vaccination of kids coming into the schools with respect to polio, measles, mumps, rubella, and that? Is that required?
it's not 100% required, no, but the nurse follows up with those that aren't to make sure they have the information on it.
But there's no statute that says.
Not that I know more of.
I thought it was.
I don't
She
know.
has
Because I come from the-
she has the answer.
Yes, ma'am.
This is the school board
Yeah.
discussion, so we can't allow a lot of conversation from the guests.
We have a Q&A time.
No,
I could just
not-
give them the
no.
information and answer
Not
the
now.
question with accurate
No.
information.
It's not your time.
Our policy is that you speak and then it's the school board discussion. And I can't vary from that, otherwise every meeting I'm gonna have to vary from that, I'm sorry.
That's okay, he can contact me.
So I come from the pro-vaccination because I was a beta study person with soft polio vaccine. Unfortunately, I found out I was given water, not the real stuff. In the original, that's how old I am. The original study of polio vaccine, I was in that study. St. Philomena's, they all lined up and all of us raised our arms and they shot us up and we found out later whether or not we got polio vaccine, the soft vaccine or water. But anyway, so it's a really charged issue, and it's unfortunate in our society that this has become such a political issue. There's reasons for this, why it became a political issue. It started becoming a political issue a year ago, summer, during the election, and it's been a political issue ever since. I got an article from a friend of mine from the Rural Health Co-op, and I were debating this issue on the phone, and he sent me this a long article on why you should require masks. But I read through it, and it really didn't convince me because I thought it was going to be some real studies. Unfortunately, CDC has not done any real in-depth research on masking. I think the problem with masking is we use masks in hospitals for years and years, but that was to protect the patient from the employee. That was a real intent in case you were in surgery and an employee sneezed into your open wound, or the doctor did something like that. That's the real where mask and surgery started, piece of trivia. And that's kind of back and forth. I think, I don't know what that we mean by masking. Is mask the homemade masks moms make for everybody?
Cloth mask, the DPI says a cloth mask that's 2 layers thick.
I mean, the size of the viruses, all viruses, is much smaller than the size of the. Yeah. But if you were required to make it optional, if a child wore a mask, he's still better protected than it would be with no mask, right?
That's correct.
And that I read the thing about the one of the guests talked about a beauty shop, and that's cited in this article. And the research there was this research operator, this beauty shop operator had 30-some customers, and they all wore masks, and none of them got COVID. But the same article cites a flight from someplace, China or someplace. Everybody wore masks, and it was one guy got COVID even though he was masked. So I'm going to just repeat what I said at the last meeting. Health is one of the dimensions of life. There's a spiritual dimension, there's a social dimension, there's a psychological dimension. And those are all pillars of life. So we all seem to be, focused on this one dimension, and I can understand why. But at the same time, we all know that masking prevented barriers, especially with the small children. Most of them don't wear it properly. I don't know how often they get them cleaned. As I said to the public health department, the nurse here, to me, masks are just can be a walking petri dish after a couple hours. It's dark, it's moist, and it's full of germs. And that's the best environment to do. So, and I'm leaning to let the parents be the best judge of what they think is best for their children. And if they want to wear masks, I encourage them to do so. If they don't want to wear masks, I do think it's still an open issue, that if there's a big flare-up in this county, then we need to revisit the issue. But right now, and if I remember correctly, if one of the reports you gave us, Kyle, was that the bulk of the COVID amongst our students came from home and not from school.
Correct.
So unless they wear a mask at home,
Had reason to have masks in school, I guess.
I guess I just have a hard time with what the public health people are recommending and what State Superintendent Joe Underlay is recommending, and then with what we're recommending.
I understand that. I just don't know when the threshold is, and they won't tell you that. So
Well, I
when does
think-
it change? When's it change from, it's safe now, I says it's too high, they won't give you a number, so how do you know, and how are we gonna keep going like this? And it just, it's tough.
It is first of all very complicated. And if anyone believes we had some success last year, Dick, we did grind through it every meeting, and we're gonna continue to grind through it, because smallpox and polio was 100 years ago. So that once it's in the history book, it's easy to summarize, but we didn't live through that. So I'm sure they ground through it also. Following the science, it matters to me a lot, science. It's what I push all the time in my background. When I first got COVID, I had it. And public health told me it was 3 months of immunity. Now it's 12 months. Science has changed. So and we've been studying, I'm a military guy, so I know masks. And the public health nurse, Mrs. Powers, last meeting said that as soon as a mask gets wet, it's no good. You gotta get rid of it. My wife teaches 4K, so we're doing more damage to these kids wearing masks. And who's gonna pay for, we're gonna change masks every hour? Because kids, they get wet all the time. So and we are trying here, this group, anyone who's listening, we talk about this a lot. In meetings, out of meetings, when I see you on the street, we talk a lot. And if there was any success last year is we looked at our admin team and Kyle and we reacted quickly. We did not wait for the next big meeting, we react. So to your point, and we watch the numbers and all the stuff on the DC medical dashboard, and we always get better interpretations. And I appreciate your inputs. And we talk to doctors from wherever, and I talk to doctors who run an ER in Houston, and a doctor who runs a clinic in Dayton, Ohio. Just dumb luck, they're my friends. So you get perspectives from everywhere. So I too agree, and you guys talk about this, the freedom of choice, but there are challenges when you live in a free nation. And I'm bringing that because of my background and how we do. And I think we're still respecting that. I think when our things change, or when they do mandate it, Dick, and they start mandating, well, there you go. When the government mandates that, when we get past an emergency youth authorization, because if it was so important, why isn't that passed? We record time, we got vaccination out, and I took it actually, by the way, too. But why is it still EUA? Does that mean there's data out there that's slowing it down, or are they being lazy? Fix it, right?
Or is it political?
I don't know, I'm not, but, following the science, I think is a cautionary word that I don't think people should use anymore, because it changes. And if you do some research, which some of us do, you'll find experts that are very credible that might offer a debate. Are they right too? I don't know. So I just think my recommendation is we continue with your recommendation. It's sound, we care about our students. And for families out there, do what you did before COVID. Take care of your family member. If they're high risk, well, take action to take care of them. That's what we've always been doing before COVID. Keep doing it. So I think those are what I would offer to this. Will we revisit this, Dick? You betcha, for a while, But I think we're reasonable here, and we will revisit as needed.
Cindy, did you want to weigh in?
I'm just confused as to what are we afraid of? Why would we not mask these kids? What are we afraid of? I'm confused about that, because we had a very successful year with masking, with having the kids mask up. The kids don't fight the masks. I guess I'm just confused as to, and we've got professionals out there who are telling us to mask up. So we mask up for 3 months or 6 months. We all know it's going to change. It is going to change. But why? I guess I'm just chagrined. I'm confused as to why we would just not go that direction.
I usually come here with all my research and I know exactly how I'm going to vote, but there are experts, there's so many experts out there, everybody's an expert. We all think we're an expert on something. I think I'm an expert on a lot of things, but I'm not right. So I don't know, I will, this keeps resonating in my mind. L. Johnson's Swedish Restaurant posted this. They said, "We are experts in making Swedish pancakes. We are not experts in managing health. So we are going to follow the guidance of the CDC or public health." And I throw this out there to be devil's advocate. If we don't follow that guidance and we have a big outbreak here, have we not been responsible in trying to protect the students and staff?
Well,
I put that out there for
I don't think
conversation.
there's a guarantee.
No, there's no guarantee.
There's no guarantee.
There's no right or
even with
wrong
masks. And I wouldn't say it's fear, by the way. It's just a choice of, and on how people make their decisions.
And I would say
Not fear.
too, like, I know just from a personal, I mean, I had COVID and I got vaccinated, but part of the reason why I got vaccinated was, like Dick said, we wanted to go back to normalcy pre-COVID, you know, not masking and you know, that's why my kids did it too, so, you know, and then we found out after that we still got a mask, you know what I mean, like, I don't know. Now we need a booster, you know, I mean, it's changing, but I think that, you know, we've talked a lot about numbers and where do we have to be, and we don't have those numbers, and we're gonna try this, just like last year we tried something, and then we moved, not even a month later, because things changed. We haven't started school yet. We have a plan that is, I think, good in my eyes, and is it gonna please everybody? No. If we mandate masks, is that gonna please everybody? No. If you give people an option, is that gonna please everybody? No. But
I guess everybody has to vote their conscience. Whatever way we vote, yes or no, we will have a room full of people here next meeting in opposition. So each person right now has to just consider, what do we think is the best for education at Sevastopol?
I move to approve the Sevastopol COVID plan of 2021-2022 as presented.
second,
We will go roll call vote. Who would like to begin? Dick?
No. Aye.
No.
Aye. Aye.
Aye.
Aye.
I'm going to say no. So the ayes have it. We will continue with optional masking.
Just so I got it right, Cindy, Lisa, were the two nays?
Two nays.
Two nays, okay.
Anything else you want to discuss on
Well,
reopening?
yeah, I'd just like to make a motion though that we did discuss the last time when we, about a year ago when we got into this.
You're using verbiage as scapegoat, by the way. If we're paying a superintendent to wait for somebody else to tell them what to do, whatever, that's fine.
I understand your
That's
frustration.
That's ridiculous.
Can't make their own recommendations itself.
Jerry?
Yeah, I think it's still on, just make sure it's still in act, that we authorize the superintendent if, between meetings, if he felt that things were getting out of hand, he could then implement his.
Just like last year.
Right, okay, just so I understand that.
I think that motion would still stand.
So yes.
yes.
So that, do you want to get into the discussion at some point about requiring vaccination?
Yeah, I certainly do. And I think it's going to become a very common place that this is gonna become.
So you would like that on an agenda?
I-
Do you
I
want
certainly
to have
would-
that
I
discussion
would like
when
to
it's
see it on the
commonplace?
agenda.
Yeah, the
I mean,
September
you're
agenda.
projecting, so do you want to have the
September
discussion
agenda.
now or when it's?
No, we can't discuss it now, we're gonna put it on the September agenda.
Well, Dave's saying September or when it becomes,
Yeah,
he's saying it's gonna be mandated. So, so then, do we put it on the agenda then or next time, is all I was asking.
Well,
If it's mandated, we have to follow it.
Well, that's,
Right.
so he's
Next
implying it
meeting.
will be mandated, and it's not a discussion.
But can it be a discussion item? I mean, does it have to be an action item? I mean, can we discuss it and start to talk
We
about
can.
it?
I
As
think
long as
Dick's-
you can mandate it.
I think Dick's purpose in putting it on the agenda is that Sevastopol consider if that's a route we want to go even before
Right.
it's mandated
Right.
in
And
some
I think
way.
if somebody, people are interested and read our agenda and want to voice their opinion at a meeting.
Can I just make it, just a natural comment? We've had this vaccine, and I've been vaccinated. I got vaccinated almost 8 months ago, so this time. This is a very short life in the history of a vaccine.
Short life and
Short
what-
life in meaning we don't, it's still, the reason it's experimental is because we still don't have enough data of the long-term effects of this vaccine. There are effects. I was talking to my brother who's a physician, my stepbrother who's a physician, who got COVID after he's had his vaccinations. And we were on the phone. And he didn't know it. He didn't know he had it, but he was going to have a meeting with his, he was going to go to a picnic with his pregnant daughter and decide, I'm going to get I've had the sniffles, I'm going to get a shot. I'm going to get a test. And he came out positive, surprised as daylight. So in my conversations with him, I said, well, I guess we really don't have to worry about any effects of the vaccines. And he said, hold your horses. There's some data coming out now about effects of this vaccine on the menstrual cycles of women. Okay? I don't know the data, I don't know if that means just 5 women have had it, or 20 women, or 2,000, or 5 million. Just that it is, to require someone to do something when something is still in its experimental stage is a really big deal.
So you're saying that unless the FDA gives full approval?
I'm not even with full approval, there are side effects.
Okay, this is a discussion we should have at the next
But
meeting.
if you want to do that, I'm open to it. But I'm just saying, there.
Yep. So this is
it's not
a
just clear
discussion
cut
we
yes
will
or no.
have, this is a discussion we will have at the next meeting.
We can talk about this if we propose.
I think we should have a discussion once. I
You
was
guys can talk about it after the meeting right now, too. Just after we do the rest of the meeting, you two can have a
We
discussion.
approve that portion of it.
Okay, we're gonna move on to new business, to the.
Can we say goodbye now, but thank you very much for the robust discussion.
We're gonna move on now to the faculty handbooks.
Last thing, if you thought the masking thing was contentious, if you go vaccination.
Thank you very
Yes,
much.
sir.
Good night.
Thank you very much, we appreciate what you've done tonight, thank you.
We'll move to the faculty handbooks. Is any comments that administrators want to make on the handbooks before we look for a motion? Anybody have questions about the content of the handbooks? Then I'll look for a motion to approve the faculty handbook.
I would move to approve the 2021-2022 Sevastopol School Faculty Staff Handbook.
Second?
Discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Questions on the seclusion and restraint report, or Ms. Margraf, anything you want to say about that?
No.
Then we'll look for a motion to approve the seclusion and restraint report.
Move to approve the seclusion and restraint report.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Item C has been withdrawn, removed from the agenda at the staff's request. Item D, the professional staff request for unpaid leave. Does an administrator want to say something about that, or is there a motion for it?
No, the recommendation is to approve Mr. Slice for his leave. It's a once-in-a-lifetime event for his family member that's,
Change of plan is pretty cool. It's a big
right,
deal.
yeah. It's not a,
It's okay. Is there a
You just don't
motion?
take vacation if you do
they only receive 2 personal days a year.
Or what are we doing if we approve this deal on your?
And I'll write a letter and document that he had his once-in-a-lifetime event,
And
right?
the employee understand, teacher, whoever, staff member understands that it is a one-time exemption.
Yeah,
And-
right.
okay, I mean,
Yeah, it's good, it's pretty clear. We've had that conversation, yeah. And we'll follow up too. When I document it, yeah.
Move to approve the professional staff request for unpaid leave.
Second?
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. We then have this list of policies that the policy committee reviewed, discussed, and we have the new protocol for approval.
I would just like to remind everyone that we did make some changes to the policy committee. Before our last meeting, Jerry was added to that committee. We did meet with the representative from Neola, and our new procedure now that the board approved is that we would approve all of these policies with one motion instead of going through each and every policy. And then Kyle is going to present the technical changes which require one motion as well. And I guess everybody has a
The
copy.
technical ones are in my report because our policy says that the technical reports the superintendent can as long as he informs the board.
Right,
Right.
that's these.
Mhm. Right.
Okay. Everybody's had a chance to read the policy.
Are these, is this a second reading? Are we still
Our
doing
new
first
policy
reading?
just, no, our new policy says after the committee has looked at it,
Right.
the board can
Okay.
approve them, and,
So this
but you can pull out anyone you want.
Yeah.
Okay, shall I wait for the motion or what?
So it's
My one
question,
question, based on our last awesome discussion, in the definitions policy, we say a school nurse is a registered nurse who meets the requirements of the Wisconsin state, blah, blah, blah. A school nurse has the authority to exclude students for signs of illness. What, under, signs of illness, what is that? And the only reason I ask is, the nurse briefed the sixth grade class, and I got feedback that her briefing was not consistent with our school policy. Did you get any feedback, or did anyone else
I
hear
didn't
that?
get any of that.
So she was briefing she was briefing more along the lines of the recommendation from the clinic, which is not the school policy as approved tonight.
This was approved tonight, the orientation was last week, Monday, Tuesday.
So that was the only reason
Yeah,
I
I don't know,
just,
Mr. Bear, I wasn't at sixth grade orientation.
Yeah, I know that's filmed and I can rewatch it, but to my understanding, the question came about in regards to quarantining. And it does follow the same recommendation that Mr. Lidkey has here, 10 days of quarantine.
in full disclosure, I was not there either.
Yeah,
And this
but I
was
can
someone
watch
who
it
came
back.
to me, so I don't have the real data, so I'm not saying we have a problem, I was just kind of curious that, and I know and respect the school nurse very well personally, actually, so I don't see it's an issue, just someone asked me, I'm like, well, that's interesting,
Right.
and then I saw this definition, so, and what they've been doing is awesome, let's keep doing the nursery's been awesome, but I just didn't know if, because of this discussion we just had, the hospital has their views and we're still, working through that, I don't, right?
And I don't know if this answers your question, but if we have a student that's positive, any sibling or member of a household of a positive case is on quarantine, whether they've been vaccinated or not, because we know they can
Which was the
carry.
same as last year, basically, maybe.
Well, last year, no one was vaccinated for students.
Oh, we're
Because the
so,
students weren't eligible for vaccine until after we got out. We didn't have students who were vaccinated last year.
oh,
Because it didn't go
yeah, I
down to
missed your last
12.
part, so if they're vaccinated, they don't have to.
No, if they're vaccinated, they're still out for 10 days because we know they can still carry it.
Oh.
So if you are out and say we have let's say a 10-year-old, a 12-year-old, and a 15-year-old, and the 15-year-old's vaccinated, the 12-year-old gets it, the younger one and the older one, they're all home because you could still carry it if you've been vaccinated.
But if they're vaccinated now, the only way you're going to prove that they have it is by testing them.
Right, they can get a
Because
test
they
and
can
come
have
back, right.
A sniffle,
Right, they get a test and come back then, right.
yeah, but who's going to determine they got to get tested?
No, 3 to 5 days for the
No,
test.
for the record,
Mhm.
I was just asking a question, I think the policy is good the way it is, so I don't want to.
To answer your question, there could be, I can see a difference between school policy and the nurse's
Correct.
clinical training and what training center.
Because unfortunately, I'm sorry that you can throw this in, there are a lot of medical community members that are not getting vaccinated, for the record, when you follow the science. There's groups popping up all over the place where trained medical nurses and doctors are not getting vaccinated. So what does that mean? I don't know.
Why
So
wasn't
we're off
there?
the, we're
Yeah,
kind of
We're
off the
going back on
topic
the rabbit
again.
hole, so
Yeah, I think we
we're
are
on
off
policies
topic.
again.
So,
Back to
if
policies.
there are no other questions about the policies, we'll look for a motion to approve this group of policies.
Can we, this is the first time since we've had this committee, why don't we just verbalize this, a motion to approve the policy committee's report?
That's,
Second?
Because there is a group of reporting these policies, and we're accepting the policy. If we're going to accept them, we just accept their report.
Okay, is that Carol, do you have that motion?
To move to accept a report of the policy.
Well, what I put for my motion is to approve policy committee's recommendation to approve the following revised policies.
That's what he
not
said.
the report, you want to approve the policies
Right.
that are included in what
Yeah.
the committee reviewed.
Okay.
So we need a motion to approve the policies.
So move.
Second?
Carol, you want to read it back, please?
A motion by Mr. Warwick with a second by Mr. Weidman to approve policy committee recommendation to approve the following revised policies, and then I have them all listed.
All in favor, say aye.
Aye.
Opposed? Motion carried. So I'm confused, do we need to have these approved?
No,
You've given them to
they
us
gave
and
you,
you've got
you
them.
have them, so that's it.
Very good. That would conclude our regular business for the evening, so I'll look for a motion to convene to executive session.
Make a motion to approve the executive session.
Second.
Roll call vote, Dick?
Aye.
Cindy?
Aye.
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 Motion approved at 8:27 PM. Okay, we are back in open session. We look for a motion to approve the co-head coaching positions for middle school cross-country.
I would move to approve the co-coaching position for middle school cross-country for Megan Horvath and Tanya Hosendare.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Middle school, high school secretary position.
Move to-
Shelley Stenzel.
Okay, I'll go. I move to approve the hiring of Shelley Stencil as middle school, high school secretary.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Middle school special education teaching position.
Move to approve Jennifer Gotzer as a middle school special ed teaching position.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Full-time special education aid position. That was Robin Gasparis.
Who
Kuparis.
cares?
Move to approve the hiring of Robin Kuparis as full-time special education associate.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. Motion to approve the school psychologist contract.
I would move to approve the agreement between Mr. Steve Warner and the school district of Sevastopol for school psychologist professional services.
Second.
Questions or discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. You know, we have dedication on Sunday at 2 o'clock. The annual school board meeting school district meeting will be August 24th. And Carl said tours begin at 5:30.
Correct.
With the meeting at 6:30. We have our school board meeting on the 16th of September. We'll meet at 6 to meet virtually with for the evaluation training. And then we'll have our regular meeting at 7 o'clock. Is there a motion to adjourn?
I make a motion to adjourn.
Second.
All in favor, say aye.
Aye.
Opposed? Motion carried.
What time do you have?
It's an early night.
What time do you have for?
Oh,
should-
shoot.
we should
Forgot. You
strive
have the
for
t-
that.
Somebody have the time.
It's a 9,
8:49.
8:49.
8:49.